Yeah, I'm proud to work in an interdisciplinary spine center, and I think the reason for that is several-fold. I think for a lot of people that have a back problem, they really don't know, do they need a surgeon, neurosurgeon, orthopedic surgeon, or would non-operative care be preferred? Most people want to be treated non-operatively when they can, but that process of selecting the right care center and the right doctor is difficult. And our center is set up in a way that we can offer the right care at the right time, which includes getting people right in to see non-operative specialists for the vast majority of spine problems, and having services offered sort of under the same roof, including things like physical therapy, injection therapy, x-rays and imaging, but also that you have continuity of care. So if your problem is one of those that doesn't get better, you have a chance of being referred to a surgical specialist who can help you, and you're not starting all over again. There's communication between the caregivers, and we can all specialize in those areas of spine care that we're best at. The question is often asked, do I need to see a surgeon? I don't want surgery, but I feel the surgeon might be best able to telling me what kind of problem I have and how it ought to be managed. The reality is in our group we have specialists that do nothing but take care of spine problems, whether they're surgeons or non-surgeons. And so both types of physician are eminently capable of figuring out what's going on and what appropriate treatment steps are. And again, most issues are best treated non-operatively, but there are certain problems that come to surgeons too late sometimes. Those usually include things that are causing weakness, causing cord problems. Certainly fractures and tumors of the spine, when those occur, probably should be seen by a surgeon and not a non-operative provider. And most of those problems should be seen on a sooner rather than later basis. Our goal in offering the right care at the right time includes giving people the care that's most likely to make them better using the most conservative or least invasive means possible. And how do you do that? Well, one important way of doing that is measuring. What distinguishes a center of excellence from just typical spine practices is we measure our outcomes and we carefully examine how we're doing well and where we need work, and making sure that each provider can offer the kinds of services that are really best optimized to get the outcomes we're looking for our patients. So for the last 25 years, a lot of the things we do are similar in terms of our goals, but I would tell you that we have newer procedures, and we also have better ways of doing the things that we've done for the longest time. Incisions have gotten smaller. We have incredibly sophisticated microscopes that allow us to work safely around the nerves and spinal cord, even in real tight spaces. We have imaging systems like navigation systems that allow us to safely put in spinal implants when those are needed. Those tools are also helpful on the diagnostic side, figuring out where the pain is coming from. I think the next few years are going to see an explosion in these technologies, and one of those will be things like artificial intelligence to help us figure out what the optimal treatments are for those rarer problems that we don't see every day. I'm very lucky to have the job I have. I love my job. The thing I like about my career most is the opportunity to get to know my patients and what they need, developing a relationship with those people, and I really appreciate the trust they place in me when I'm taking care of them and on occasion operating on them.